And for more on China's healthcare system, I'm now joined by Dr. Lizheng Shi. He's live for us from New Orleans. Welcome to the broadcast.
Thank you, Jessica. Thank you for having me.
Well, doctor, last week, Beijing announced it will end the 15% markup on drug prices in Chinese hospitals. What is this going to mean for patients?
Well, that's mean a lot. In the short term, obviously, this is a good news for the Chinese patients. But hospitals who have already implemented this non-markup policies have not seen a big drop in their overall revenue because hospitals may respond to this policy change by raising the user fees or increasing admissions. So therefore, the government at all levels and the social health insurance programs should step in to make sure the out-of-pocket payments by patients will not be negatively affected by the cost of those rising costs of the medical services.
Right, because you're talking about a lot of hospitals have used these markups to essentially fund their bottom line. That's how they've been doing business. So they're going to have to recoup their costs somehow. I heard you talk about passing on fees possibly to patients, but there's also been talk about maybe more property taxes as well, because the hospitals need to recoup these costs, don't they?
Well, that's a lot of things we need to happen together. So I think the major challenge is that in China is that the medicine policy reform might end up with the pricing for the drug keep falling while the profits of pharmaceutical companies are really under pressures. So in my view is that a innovative medicine procurement and supply chain management are needed to ensure that quantity and quality of medicines are available to meet the healthcare needs and also promote research development in the industry. But without current
Go ahead. Sorry, doctor.
The comprehensive reform is going to end up, the hospital might have a budget deficit and then also the dissatisfied patients.
Right, but part of what the government was aiming for, right, was to prevent overprescribing with the aim to raise funds for the hospital, right? Do you think that this measure addresses that concern?
Oh, of course. I think the Beijing's recent move to end hospitals' markup is a very significant step to rationalize cost structures of healthcare in China. As you know, that the drug revenue has been the major component within the hospital's revenue structures, kind of ranging from 60% in those community health centers to about 40% in high-tier hospitals. So this practice has been long criticized by the policymakers and general public because on that kind of cost structures, doctors tend to prescribe more and more expensive drugs.
And of course, this is a problem all over the world, particularly in the United States, where some of these drugs are essentially created, at least designed. What can the Americans learn from the Chinese with some strategies to lower drug prices? Because, for example, in Europe and Canada, drug prices are far lower than they are in the United States or China.
Well, that's a very complex story, and we can talk a lot more than the time allocated here. So, but I think China has taken a very interesting step, which is a step-by-step to implement the zero markup policy. It started with its initial implementation of policy in the community health centers about 10 years ago. Of course, it comes along with essential medicine policy in those institutions as well. More recently, this non-markup policies has been pilot tested and expanded to many high-tier hospitals. Of course, to make up the loss of drug revenue, government has provided either direct subsidies or fee changes in medical services, such as the diagnosis fees change.
Let me just get to one other aspect of the reforms, which is this promotion of family physicians as the main entry point for people in China. It's something that the Chinese government has been pushing, but they don't have enough primary care physicians in the pipeline to service the needs. So where do we go from here with respect to primary care?
I think the primary care initiative is a very important policy, and it will certainly be instrumental to improve the quality and access to healthcare in China. China is planning to expand this initiative to cover all its population by 2020. But in terms of training, the family doctors are trained as gatekeepers and the care coordinators to ensure the more convenient quality health care for residents who have signed a contract with them. So I think it's going to be very important to get a quality GP doctors in place to provide a quality care at a more convenient way for patients.
And it is a nut that everyone is trying to crack around the world. Healthcare costs are a tremendous burden on patients and on governments alike. Dr. Lizheng Shi, thanks for joining us from Tulane University in New Orleans.